Good evening. You're watching the main news on HKIBC. I'm Sarah Wong. Our top stories tonight. Hong Kong adds another 6,000 COVID infections and 14 deaths as authorities hint at further tightening social distancing measures. No street parties for foreign domestic helpers amid warnings of a $5,000 fine for breaching public gathering ban. And Canadian police resort to force to disperse protesters from the streets. Hong Kong's daily COVID caseload exceeded 6,000 again today. Health experts are warning that the city's fifth wave is still on the rise. Wong reports.
It's another day of new local cases in quadruple digits. 6,067 to be exact. There were also 14 more COVID-related deaths. At the press conference today, health authorities revealed they will stop announcing the number of daily preliminary positive cases for now. That's due to the large amount of backlogged samples waiting for confirmation. Preliminary positive case numbers can no longer effectively reflect the latest situation, they said.
For the testing arrangement, yes, we are upgrading, equipping our testing capacity. With the help of the mainland experts. So we expect the testing capacity will increase soon. So to cater for the need to test, and also because of the rising trend of the reported case in Hong Kong.
The officials also pointed out that reported, confirmed, and preliminary cases went from around 4,000 per day earlier in the week to over 10,000 on Saturday. Current social distancing measures will not be going away anytime soon. Most patients who've been waiting for treatment outside hospitals have now been moved indoors. But the hospital authorities said the overcapacity problem is barely fixed.
So in view of the cold weather and also the raining situation, we have mobilized all the available indoors area, including the day center and also some physiotherapy departments indoor area, to let the patients move indoor instead of outdoor. And at the moment, only a few number of cases while waiting for the triage staying indoor. But at the same time, if there is a large influx of patients, inevitably some of them may need to wait for a while.
The officials today also publicly thanked frontline medical staff for working tirelessly during this period. Wong, HKIBC.
A team of medical personnel who arrived from the mainland in the past few days continues their tour of Hong Kong's COVID facilities. This comes as Health Chief Sophia Chan hinted at even tighter social distancing measures in the coming days. Macy Mock reports.
With the current round of social distancing measures due to end this coming Wednesday, the health minister has already poured cold water on hopes of a relaxation. Instead, Sophia Chan warned that the curbs may be tightened further. While crowds are no longer seen in malls or on the streets, she said the flow of people must come down even more to break up transmission chains in the community. On a separate note, the team of mainland medical personnel were out and about today inspecting different facilities. Led by Zhang Yuren, Deputy Director of the Guangdong Provincial Health Commission, the group visited community testing stations in Yau Ma Tei and Ma On Shan to familiarize with the testing procedures. They did not speak to the media afterwards. Also from today, SAR authorities received a batch of 150,000 boxes of anti-epidemic Chinese medicine donated by the central government. Commerce Chief Edward Yao and Undersecretary for Health Choi Tuk-yi were at the scene to take delivery. Apart from Chinese medicine, the city will also receive tens of millions of rapid antigen test kits and face masks from across the border. Maisie Mock, HKIBC.
The streets of Central, which are usually filled with foreign domestic helpers, were mostly empty today. While the cold weather may have played a part, many were deterred by a warning that police will show no mercy to those who breached the two-person gathering limit. Joanna Ho reports.
A stern warning from the chief executive that there will be no leniency for those who breached the two-person gathering ban seemed to have worked. Foreign domestic helpers who usually fill the streets around Central on Sundays were mostly gone. Police and Labor Department officers were seen patrolling the area, ready to issue 5,000 Hong Kong dollars fines to violators.
This is Statue Square in Central, a favorite spot for domestic helpers to gather on weekends. Authorities put up banners everywhere, reminding them not to bunch together. But with a cold snap and occasional heavy rain, very few of them turned up anyway.
This helper decided to come out anyway, saying she needed to catch a breather.
No, go out because, 6 days stress, then need to go out. But for myself, I know how to protect myself.
Most said they were aware of the consequences should they contract COVID. Yet, this helper said she only got one chance a week to meet her friends. Therefore, she chose to come out but insisted she would strictly follow the rules and practice personal hygiene.
Oh yeah, of course. Everyone is afraid of that. So, yeah, we also avoiding this kind of cases, Mom. So, not because we are outside and we do gathering. No, we also afraid just like employers too.
Others were less lucky, such as this helper who was issued a penalty ticket for breaching the gathering ban. Labor Secretary Law Chi-kwang called on employers to convince their helpers to stay at home during holidays. He said one incentive is to offer the helpers full compensation. Joanna Ho, HKIBC.
The head of the hospital authority said fewer people are now made to wait outdoors amid a surge in demand for emergency services. Tony Cole said that's because some elderly patients were redirected to Asia World Expo, and authorities are looking to set up more makeshift shelters. Macy Mock has more.
In a heartbreaking scene, non-urgent COVID patients, many of whom elderly, had to wait outside the city's public hospitals for hours before a doctor could tend to them. Given an update this morning, hospital authority chief executive Tony Ko said the situation has eased a little bit. He explained some elderly patients had been stranded at hospitals after the nursing homes they came from reported an outbreak. The Social Welfare Department eventually stepped in by transferring some of them to Asia World Expo, freeing up more beds at hospitals. Authorities are also looking for suitable sports centers to temporarily house patients. On a more positive note, 7 designated clinics for mild COVID patients have been running smoothly.
In the last few days, we observed that in general, there are around 800 something cases going to see a designated clinic per day, whereas our capacity is over 1,000 per day. So on the whole, at the moment, we are still cope with the service demand. But we understand that the service demand may not be evenly distributed among the different regions, because obviously for some regions, if there are more cases or there are outbreaks, then the demand will be higher.
He pleaded with people who are preliminary positive or display minor symptoms to wait for instructions at home or visit a designated clinic instead of crashing the emergency room. Maisie Mock, HKIBC.
Doctors and pharmacists are urging parents to sign up their children for COVID jabs. This comes after a survey by the Society of Hospital Pharmacists suggested that less than a quarter of parents with children aged 5 to 11 had such plans. Many were worried about side effects or even death. Society President William Choi said authorities ought to do a better job clarifying the misconceptions. He added children with asthma especially need the jab to minimize the risk of respiratory diseases. He suggested providing more data to parents. Overseas, the Queen of England has tested positive for COVID, according to Buckingham Palace. The British monarch is reportedly in good condition, with only mild cold-like symptoms for now. She is expected to continue light duties at Windsor Castle this week. Her positive test comes after her son Prince Charles was diagnosed with the virus for the second time earlier this month. His wife Camilla also tested positive on Thursday. Canadian police have arrested over 170 people in a bid to regain control of the streets from the hands of anti-mandate protesters. Many demonstrators retreated, but some have vowed to stay. Truckers protesting against COVID restrictions in Canada put on a show of defiance as baton-wielding police swooped in to disperse the relentless crowd. Hundreds of vehicles have besieged the parliament and blocked traffic in the capital, Ottawa, for 3 weeks, demanding that a vaccine mandate be dropped. Standing arm in arm and chanting slogans, participants of the so-called Freedom Convoy vowed to stand their ground as officers advanced.
We just want a safe, peaceful end to this. There were snipers on the roofs of all of our parliament buildings. This is absolutely disgusting what has gone on.
Wow!
Chaos erupted as mounted police charged towards a group of demonstrators, some of whom were seen pushed to the ground. Officers also used pepper spray and stun grenades to push back against the crowds, which hit back with smoke canisters. As the standoff intensified, organizers asked Truss to withdraw while accusing the police of deploying heavy-handed tactics.
They faced a barrage of resistance, shoving, and vitriol. We all saw that the protesters were aggressive with the officers, and we needed to use horses at one point. You have our commitment that we are here until the very end. If I had a choice, it would be right now.
At least 50 vehicles have been towed away and dozens of people arrested in Canada's largest ever police operation. But it might not be enough to end the weeks-long revolt, as protesters are likely to move their rallies elsewhere. On to the weather now. Remember to stay warm as the cold snap will stay with us for a while. Temperatures will hit a low of 7 degrees tomorrow, but expect conditions to gradually improve by the middle of the week. Now let's take a look at the weather around the world. That's our main news for Sunday night. Join us for more news at 11. I'm Sarah Wong. Please stay safe and take care.